As tensions continue to rise on the inevitability of COVID-19 in Belize, media personnel were today sensitized about the novel coronavirus and what is the contingency plan going forward. Facts are that in 23 days, the virus spread to 118 countries. Up to March 12th, there were 4,614 deaths associated with the virus, and the rate of infection is 2.6 persons to every infected individual. 22 of the 35 countries in the Americas have confirmed cases, with Guatemala now recording its first case. The last time a pandemic was declared by the World Health Organization was in 2009 due to the spread of H1N1, better known as swine flu. To date, there are no confirmed cases of COVID-19 in Belize, and the Ministry of Health is actively searching and working with the community for prevention.
It has been a lot of information being shared with us. We get information from various sources, from yourself, the media, from the public. We have made it public that we do have a 0800 MOH Care phone number for persons to call and share their concerns, to clarify any rumors, to address any information that they may not be certain about. If we suspect, if we are concerned about somebody with signs and symptoms in relation to COVID-19, we created an information card, and the flip side of the card has cell number contacts for surveillance persons or surveillance teams that are headed per district.
Claudette Dakers-Norales is also the communications officer for a recently created task force that will be responsible for the timely dissemination of official information as it relates to COVID-19. The task force, along with a cabinet-sanctioned national coordinating team, is responsible for on-the-ground awareness campaign for public sensitization about the virus and steps to be taken. Heading the education campaign is technical advisor for the Health, Education and Community Participation Bureau, Kathleen Azueta-Cho.
The Ministry of Health is working closely with the Ministry of Education. We will be meeting with them on Monday, along with other partners like the Red Cross Society and UNICEF. We're pretty much strengthening our forces, going into the schools. All the education materials have been shared among all these organizations and line ministries. The idea is to keep the prevention messages going. Start looking at your plan of action, identify a space, if possible, in your facility that you could possibly use as an isolation area. If you have persons who are looking after an individual who is displaying symptoms, have just that one person looking at that individual. Avoid crowd or people waiting, too much people waiting in the reception area or the crowded areas. Again, just being extra cautious. If you're sick, try to avoid going out and interacting with other people in the community.
There have been several unconfirmed reports of suspected cases of COVID-19. The most recent circulating was that a 3-year-old exhibiting respiratory complications had been rushed to the KHMH from a medical center on Southside Belize City. Now, even though the symptoms may be similar to that of the novel coronavirus, the ministry defines a suspect case using several factors, including an individual's travel history, among other things. Dakers-Norales shares how the announcement of the first laboratory-confirmed case in Belize will be made using regional standards established by the Caribbean Public Health Agency.
Ideally, depending on the time of this announcement, we would do a live broadcast through the assistance of the Government Press Office to have either the Minister, the Prime Minister, or the Director of Health Services to publicly announce that we have confirmed our first case. Immediately following that live announcement, a press release will be sent out. And as well, our international partners who need to know of this first case will also be notified as soon as possible. That press release will include age, gender, location as closed as a region. The Ministry of Health has several regions, northern, southern, central. We will identify that region. We will speak of where the person is being managed, and as well our contact trace activity that will follow based on that confirmed case.
This novel coronavirus is not airborne and is transmitted when an infected person contaminates a surface, which is then touched by a healthy person who then touches their eyes, nose, or mouth. It can also spread when an infected person sneezes or coughs within less than 3 feet away from another person. This is the reason why social distancing and hand washing are among the best practices that can be adopted.
It's not a matter of if, it's when. We ask you to continue to regularly wash your hands with soap, with running water. You can use a hand sanitizer, 70% alcohol base. There's also ways of making your own sanitizer, as well to practice good cough, sneeze etiquette, social distancing. It's basically to keep stressing on the preventative measures so that when COVID-19 comes to Belize, there's as less or mitigated in the spread of the infection.
Duane Moody for News 5.